most important to begin with, what is purpose of this video? Yes, we started with read less technique. From read less technique मतलब कम पढ़ना है, we are coming to the point technique. सिर्फ हम पॉइंट्स कवर करेंगे. यस, इन इस वीडियो में हम 2 लॉन्ग आंसर क्वेश्चन और एक शॉर्ट आंसर क्वेश्चन कवर करेंगे. सो लॉन्ग आंसर क्वेश्चन दैट इज टी एम जॉइंट. अभी मैं सिर्फ पॉइंट बताऊंगा आपको. यस, हाउ द जॉइंट इज फॉर्म. दिस इज मैंडिबुलर फोसा and this is head of mandible. Mandibular fossa and head of mandible. Yes, this is mandibular fossa. Yes, I'm magnifying it. This is mandibular fossa, and of course this is head of mandible. Simultaneously थोड़ा सा प्रैक्टिकल एस्पेक्ट भी इसमें कवर हो जाता है. सो हेड ऑफ द मैंडिबल एंड मैंडिबुलर फोसा. रिमेंबर, इट इज साइनोवियल जॉइंट. नाउ just enumerate point wise what are the ligaments. Ligaments are capsule, articular disc. Yes, you have to label this. Articular disc, most important because it divides the joint into 2 compartments. So capsule, articular disc, sphenomandibular ligament, stylomandibular ligament. This is last minute revision. Capsule, articular disc, sphenomandibular ligament, stylomandibular ligament. Some books call sphenomandibular ligament, stylomandibular ligament as a false ligament. So true ligaments, false ligaments. Just forget this classification because this is last minute revision. Remember, this is last minute revision, so forget this classification. Now most important and critical are 2 points, that is blood supply and nerve supply. Blood supply is superficial temporal artery. I am repeating, bit slow. Blood supply is superficial temporal artery, and nerve supply is auriculotemporal nerve and masseteric nerve. Other points you may add: this joint bilaterally acts as a single unit. This joint bilaterally acts as a single unit. I am a bit slow. This joint bilaterally acts as a single unit. This is a critical point. You have to underline this point. This joint bilaterally acts as a single unit. I am repeating it 5 times. This joint bilaterally acts as a single unit. Purpose है कि आपको कम पढ़ना लगेगा, आपका पढ़ना that is reading time आपका कम हो, ये आपका purpose है. So this joint acts bilaterally as a single unit. Rarely they ask movements, that is elevation, depression and side to side movements. So this is a brief coverage of TM joint. Suppose person forgets to read or forgets main points at the end time, so this video may help the person a day before exam. So this is number 1, that is TM joint. Now coming to pituitary, this is another LAQ. Yes, we are covering LAQ. Yes, what are parts of pituitary? This is pars distalis. This is posterior pituitary. This is anterior pituitary. This is posterior pituitary, but never forget this is pars intermedia. This is pars tuberalis. And just encircle it. Look here how I am labeling. Most important, not what I am labeling, how I am labeling. Just encircle it as a pituitary stalk. Encircle it. Look at that. That is pituitary stalk. So anterior pituitary, posterior pituitary, pars intermedia, pars tuberalis, and pituitary stalk. Somewhere here is the location of pituitary. So simultaneously practical part is covered. So this is location of pituitary. Yes, this is middle cranial fossa. Yes, look at this, my finger. So location of pituitary. I am repeating: pars intermedia, pars tuberalis and stalk. Never forget to label the stalk. Now rarely, though this is anatomy, they ask hormones secreted by pituitary. So hormones secreted by anterior pituitary: growth hormone, FSH, prolactin. 3 names are more than enough because this is anatomy. Posterior pituitary never secretes the hormone, it stores the hormone. This underline this sentence. Posterior pituitary never secretes the hormone, it stores the hormone. Two hormones, that is oxytocin and ADH. Oxytocin and ADH. Oxytocin and ADH. Oxytocin and ADH. So we are coming to the points technique. Now, applied anatomy. Just remember two words: hyperpituitarism, hypopituitarism. And if you want to secure a distinction, you may add gigantism, panhyperpituitarism, panhypopituitarism. But these are additional points: hyperpituitarism, hypopituitarism. I'm repeating. Hyperpituitarism, hypopituitarism. This is last moment revision. I'm editing maximum point, but never forget again blood supply. We have done blood supply, now supply here. So blood supply, yes, superior and inferior hypophyseal artery. I'm a bit slow. Blood supply, superior and inferior hypophyseal artery. Superior and inferior hypophyseal artery. Now coming to one SAQ, that is hilus of kidney. Yes, this is hilus of kidney. I'm showing you. This may be asked in exam. So renal artery, renal vein, you can see. So renal artery, renal vein and pelvis. So this is a short answer question. What is present at the hilus of kidney? Renal artery, renal vein and pelvis. Renal artery, renal vein and pelvis. Rarely you may add its clinical importance, both in theory and viva. Yes, this is a place where there is a staghorn calculus. Staghorn calculus. This is a place where there is a staghorn calculus, and at the most, I'm just saying, staghorn calculus. And this is a location for usually some types of kidney cancer, so renal cell carcinoma. So this is additional. So renal artery, look here, renal vein and pelvis. Renal artery, again renal vein and pelvis. Renal artery, 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 renal vein and pelvis. So I hope in this video we have covered two long answer question, one short answer question. Disclaimer: students are advised to read syllabus. This is ideal reading. This is a last moment revision, so that this creates confidence in student, and student never will give the paper blank. Student blank नहीं देगा पेपर, कुछ ना कुछ लिखेगा पेपर में.